It wasn't until I was in the ambulance that I realized that it was actually my heart. Something felt off. I was having cold sweats and it wasn't going away. We made a couple really good decisions at that moment, and one was to get within the NYU Langone System.
The way I like to describe it to patients is that the heart is a pump. There are the three big arteries that kind of keep it alive. One of the most important ones is called the LED, the one that goes to the front of the heart. One of the words that we don't like to use is a widowmaker. When Ken showed up, he actually had 100% blockage of one of his arteries, and we knew that we had to act right away and open it up for him.
A week before my heart attack, we had a family trip to the Black Hills in South Dakota. We're hiking, we were chopping wood, building fires. There was a lake there, so I swam across the lake with my son. No red flags, per se.
There are patients who are actually pretty healthy who end up with heart attacks and heart disease. So Ken is actually somebody who is very active physically and ended up with a heart attack. It's very important to have an early recognition of the symptoms and also to seek early medical care. Time is heart muscle. So the earlier that we get to the artery and open it up, the faster that we improve the heart function and the less likely that the patient will end up getting heart failure or any sequelae of a heart attack. At NYU Langone, we've actually gotten multiple awards for doing less than 60 minutes and have gotten very good outcomes in terms of quality long term.
My overwhelming feeling is one of gratitude. Being in New York City and then having access to, arguably some of the best healthcare in the world. It's very, very lucky to be there, and I think were it not for that, I wouldn't be here now.